Hello everyone, I'm Dr. Yashodhan Deka, consultant laparoscopic surgeon and endometriosis specialist, Nalbari Maternity Hospital and Sarathi Hospital, Nalbari. With immense pleasure, I would like to inform you that we at Nalbari have now slowly evolving into an endometriosis clinic where patients from around entire Northeast have been approaching us for treatment of endometriosis. We have now operated more than hundreds of patients of endometriosis, and now patients are traveling from different states as well. Endometriosis, which is very commonly known as chocolate cyst, is a very painful and a disease with great social stigma. Endometriosis, when it becomes very severe, it impacts the life of a woman terribly. She loses 4 to 5 days of a week, working days of her life every month, and the pain is intense when endometriosis is very severe. Endometriosis can affect not only the uterus and the ovary, but it also affects the bowel, the appendix, and it can go as far as the diaphragm or the lungs. Endometriosis or chocolate cyst has various treatments. There can be medical management as well as surgical management. We will emphasize more on the surgical aspect of it. We at Nalbari are operating on a 3D camera system, which gives us immense benefit of enhanced patient safety and also decrease operating time, and we are able to handle all grades of endometriosis, all previous operated endometriosis. We bring you a very interesting case of a patient who has approached us all the way from Arunachal and traveled so far to us for treatment of endometriosis. She is not married and she has a huge endometrioma which was picked up on a routine ultrasound which she got performed for pain abdomen. So I suggest that any girl, any woman who has very painful menstruation to kindly approach a gynecologist, at least to get a routine ultrasound done, so that right treatment can be achieved at the right time. Endometriosis is a recurrent disorder, and that is what makes this disease very peculiar, that its symptoms are only associated during the menstrual cycle. The rest of the time the patient is absolutely symptomless. So whenever you are suffering from very severe pain abdomen during your periods, please approach a nearby gynecologist and get an ultrasound done, so that endometriosis, when detected early, treated early, can cause much less damage to the system. Come, let's listen from the patient herself about her journey of endometriosis and how they reached to us and how happily she is going back and will lead an absolute pain-free life. Thank you.
I was having severe pain for a few days in my abdomen, so I went to a doctor who advised me to go for ultrasound, and where it was diagnosed to be a cyst. After which I consulted Yashodhan Deka sir of TRIMS Naharlagan, who referred me to Dr. Yashodhan Deka sir of Sarathi Hospital, Nalbari, and who advised me to go for MRI, where it was confirmed to be a chocolate cyst. Since it was big in size, I needed urgent surgery. So I was operated at Sarathi Hospital, Nalbari. The team who conducted my surgery was the best team, and I am satisfied with the care and hospitality given by the entire staff. Also, I would like to recommend the patients suffering from chocolate cyst to kindly visit Dr. Yashodhan Deka sir for consultation. Being operated far from my hometown in Arunachal Pradesh was not a big issue here, since the staff were really helpful. Also, since I had an insurance done with Raksha TPA, it helped me a lot financially. Thank you.
Expert teamor hoite Sarathi ase apunar babe apunar logot.